Assalamu alaikum wa rahmatullahi wa barakatuh. Medical preparations for Hajj and Umrah is very important before departure. You will be able to concentrate better in worshipping Allah subhanahu wa ta'ala if you take care of your medical problems before you go. In this episode, inshallah, I will be talking about attention to chronic illnesses and mainly diabetes. Diabetes presents special challenges for the person who is going for Hajj. Let's go through it and you'll see what I mean. Symptoms of uncontrolled diabetes are the following: tiredness, lethargy, frequent urination, thirst, blurred vision, loss of weight, and decreased concentration. You really don't want to go for Hajj in this state. It will not allow you to concentrate, and you are not going to be able to worship Allah subhanahu wa ta'ala in the best possible way. So the first thing for you to do is to make sure that your diabetes is under control. Visit your doctor, very important. Not do that early so that the doctor has a bit of time to get your diabetes under control. Now the doctor would do a test called a glycated hemoglobin or an HbA1c, and this test tells you whether your sugar has been controlled or not in the last 2 or 3 months. So it's a very valuable test to do. Now the test that you do on your test strip on your finger, this tells you what your glucose level is at the time when you're testing it. It's important to do this on a fasting level and 2 hours after a meal. But make sure you take enough strips with you, because your machine may not be available in Saudi Arabia, and you're going to run out of strips. So please make sure that you take enough strips with you for you to check your glucose levels there, and check it frequently so that you know that everything is under control. Now, as far as controlling diabetes is concerned, let's look at the different things that you need to do. The first and most important thing is you have to maintain your diabetic diet. A diabetic diet, basically, you have to exclude all sugar-containing substances, and be careful of fruit juices, because some of the fruit juices are very rich in sugar, especially mango juice. Be careful with the fruit juices because they can raise your blood sugar level. Now, as far as white flour is concerned, white flour also changes to glucose in your body in a very fast, very quickly, with the result that you will find that your blood sugar levels will go up. You can replace the white flour with brown flour. That's fine. Rice also raises your blood sugar levels. Brown rice will raise it a little less, but it will still raise it. So just be careful with these 3 things: sugar-containing products, white flour, and rice. These are the main culprits that cause blood sugar levels to go out of control. Now, and maintain this diet throughout. As far as the medication is concerned, you may either be on tablets or tablets with insulin or on insulin. Now you must make sure that you take these medications regularly and on time. Remember, tablets like metformin and glucophage need to be taken immediately after a meal. The glibenclamides like glycomin, Deonil, and Amaryl, and all those, they require to be taken about 10 to 15 minutes before your meal. So you have to make sure that you take them correctly. As far as insulin is concerned, insulin requires a moderate temperature. You can keep it in your pocket because there are pen sets which you keep in your pocket. But the weather in Saudi Arabia is very hot. You're looking at temperatures of 40, 45, 50 degrees, and you cannot keep these pen sets outside for long periods of time. So you must keep it in your room, which is room temperature. Transporting it from here to Saudi Arabia, make sure it is in your hand luggage, not in your luggage that you check in, because in the hold the temperatures can go down anything to minus 30, minus 40, minus 50 degrees, freezing temperatures, and you cannot allow your insulin to be frozen because it makes it ineffective. So high temperatures make it ineffective, and freezing conditions make it ineffective. So those two, you got to keep them at a moderate temperature. So be careful how you transport your insulin and how you use it. Very important for you to make sure that you do regular blood sugar tests if you're on insulin because of hypoglycemia. On the 5 days of Hajj, because you're going to be away from your hotel room, you may need to carry a cooler bag with you and a cold pack to keep your insulin cool, not frozen, cool. Another very important thing with diabetics is foot care. Make sure that your nails are cut before you go. Watch out for ingrowing toenails. Make sure that you don't have any ingrowing toenails. Look for any rashes on your feet, in between your toes, dryness around your heels, dryness around under your feet. These are usually indicative of fungal infections. Watch out for sores and ulcers. They need to heal before you go. Your footwear is very important. Make sure you wear a broad-fitting, soft shoe with a heel and an instep support, because it's important that you don't hurt your feet. Most diabetics have numbness in their feet, or they have tingling in their feet, and it's difficult for them to determine any irritation. Put your hands inside your shoes or inside your footwear to look for any ridges that may be there, or any nails, or anything that may irritate your skin. Look after your feet there as well. Avoid being trampled on. If you keep a space between you and the person in front of you, so that they don't trample on your feet. Be careful during tawaf. Be careful during Safa Marwa, that you don't hurt your feet. If you control your diabetes before you go and maintain this control, you should have a wonderful Hajj.